Hey beautiful soul, even if you think that you know everything about hair transplant and you have done enough of research, you have met each and everyone on the planet and you know everything, there might be still some hidden facts which nobody would like to talk about. And these facts are so important. In this video, I'm gonna show you something which is so important which you cannot afford to miss. So stay tuned and watch the video till end. I'm your friend Dr. Shail Gupta and I'm a hair transplant surgeon who has been operating for almost 20 years now. Now, when you see results, when you look for hair transplantation, you obviously compare what kind of area coverage X clinic or Y clinic is giving. You compare uh, the density, you also compare the aesthetics of your hairline. Now this clinic is giving a great density, even a cheaper clinic is giving density, but now this clinic is giving a beautiful hairline, the cheaper one is not giving a beautiful hairline, so I must go pay money there and get the surgery done. So the results which you are actually watching may not be real. Have you heard about a hair fiber which you spray on the head and it gives you very good full coverage? You must have heard or you might have seen such cases, but have you heard about an oral hair fiber which you don't spray, which you actually eat? Yes, it is finasteride. I'm talking about finasteride, which is a DHT blocker. Now, uh, one of the biggest lies of hair transplant industry is we have done your transplant. Now we are giving you finasteride just to sustain your hair. So, do you really think finasteride just helps you in sustaining your hair? It does not do anything else? You need to watch this. Now, take a look. This patient is our own patient. We are treating this patient in our clinic. You can see this. These are the pre-pictures. So you can easily say this is kind of grade 6 or grade 7 patient. Even if you zoom out, zoom in the pictures, you will see there are hardly any hair. Although you will see a lot of such cases where people shave off even these small miniaturized hair. But these areas, even in apparent grade 6, 7, are not completely bald. There are so many miniaturized hair. As you can see in this video, this is a dermatoscope view of the areas where patient apparently does not have hair. You think that there are no hair, but if you watch in the dermatoscope, there are a lot of hair in that area which respond to finasteride and they become thicker, but still they retain their softer character. So what will happen? Now see what happened to this patient when we gave him 1 mg finasteride per day. Just be ready to watch the miracle. Now see what happened. Oh my goodness, look at this. Few months of finasteride did this. Come on. Now, a lot of people put comments in the videos which I make. Some people say, okay, I am a regular finasteride user. I have been using it for 3 years, 4 years now, but it did not bring that much of result and you are over projecting things. So I would urge them to stop finasteride now completely and see what happens, how much support they were getting because of finasteride. But now, because and I would definitely like to ask them, if they had started suppose 3 years back finasteride, what was the curve of finasteride like in the beginning for 6, 7, 8, 9 months? Maybe the graph went up, the growth went up, then it achieves a plateau, maybe sustained on that, and then it starts dipping down. That's called tolerance. It happens. So if for 3 years if you are taking and you are not noticing any major response, you might be the one who is non-responder or less responder to finasteride. But not everyone is a non-responder. Finasteride does magic in most of the cases. Most of the cases. Now, if you see this, now take a look at the middle portion or crown portion. There is so much of new hair growth. Anybody can say that this, they have got some transplant done or maybe something like that. If you put some hair in that area, it will look amazing, awesome. The size of the circumference of the crown area or empty area has reduced significantly because of new hair growth, because of finasteride. Now, the surgeon who is actually operating has to do less work. Even if the surgeon is less skilled, you will be able to manage. Now, take a look at the hairline. Apparently, there was no hair, you can see. Now, when you see this, there is so much of hairline. It has given density, it has given coverage, it has given so many softer hair in the hairline that this is going to look great if somebody puts some grafts in there. And you will say, now I receive comments, it hurts sometimes because people say, sir, you are good, you are honest, you make lines, good lines and all that stuff, but I like this work because their hairline looks better. Now see, with Finasteride 1 mg, hairline is bound to look better. But what will happen to this guy when he stops? All these hair which you are seeing there, they will just be blown away. Not only these hair, in his case he did not have many hair, but people who are grade 4, grade 5, grade 3, they have a lot of miniaturized hair which are still viable. And in those cases, if Finasteride 1 mg per day is given, you can expect miracles. Go just type on internet Finasteride results without transplant. You will get to know all the cases. Visit those sites. I have made some videos on this. Please go and watch. You will save yourself from a lot of fraud, You will save yourself. Suppose, now this is 1 mg Finasteride per day. Okay. Now what will happen if I reduce the dose? Now this patient actually got some side effects. The side effects of the medicine. I have made many videos about this. You can go and watch, see the playlist. Anybody can have side effects because of the medicine at any point of time. You understand this? So maybe if you are, say, not facing any side effect in the initial phase, maybe an year or so, but when you face the side effects, maybe after 1.5 years or 2 years, you will have to reduce or stop the medicine. Then obviously all the hair will fall. Now, in patients who have still significant number of hair left, grade 3s, I am talking about 2s, 4s, in those patients, because medicine makes you dependent. So, in case you stop the medicine, you will lose those hair also which got used to the medicine, otherwise they were living happily there. But these hair are also going to fall. Now, importantly, when you stop, now in this case we had to reduce it to half the dosage, 0.5 mg. So you can see what happened when we reduced the dose. The efficacy reduced significantly. Okay, so if you compare the 1 year, the 1 mg dosage picture with 0.5 mg, the growth reduced significantly. Look at the crown area, middle portion, look at the hairline. There is significant reduction in hair regrowth. So the medicine is not being just given to sustain your hair, that is a lie. Medicine is actually being given as a blanket treatment so that it covers a lot of things and it can hide and or camouflage the incompetence of your surgeon. You understand? Yes. So you might have been seeing a lot of clinics claiming that we do best grade 6 or grade 7 results. You will not find any great as result of grade 6 or 7 than our clinic. Now look what is Finasteride doing. So look, if the clinic is consistently prescribing 1 mg Finasteride to everyone, this is an eye wash. Now you will see many clinics saying that we do FUE. We are doing only FUE. I have made tons of video. Go and watch Go, and if you haven't subscribed the channel, subscribe channel so that you don't miss any information. See the journey, see the videos which I have made over a period of last 3-4 years. You will understand everything. Okay, you will understand everything. Now, when to make full use of your donor, you cannot just rely upon one technique, FUE. You cannot take out that many. People might say that we are doing 6,000, 7,000, but it is all bluff. Okay, not possible. Without incorporating FUT, and FUT also has to be done sometimes twice or thrice to get that many grafts. Okay, so if your surgeon does not know how to do FUT, and he is bound to give you finasteride. Without finasteride, they cannot work. Please use your brain. It's such a common sense thing. If you don't have numbers which you can actually give, you will have to rely on other means. And what is the other mean? The other mean is this finasteride. Now, another important thing. Suppose you might have heard people saying that, okay, you need to take finasteride for a year maybe, and then we will reduce, and maybe your baldness gene will get switched off or something like that. Huh? Must have heard. Now, again, this is an eyewash. Again. Because, you can see what happens when we reduce the dose. And sometimes when we don't reduce the dose, obviously there is going to be tolerance. Okay, now all your well-wishers, all your people will say, okay, fine, we are giving finasteride because we care for you, and we are giving at 1 mg per day because we care for you. The other clinic, or maybe Dr. Shail Gupta, does not care for you because he wants to do another transplant as soon as possible. So he won't say you take finasteride or whatever. But if a doctor is suggesting you not to take finasteride, or maybe take it at a very small dose, he is not your well-wisher. Because the best way to sustain your hair is 1 mg finasteride per day. Now the introduction of this medicine, the timing of introduction of this medicine is very important. Do we really need to give this medicine immediately after transplant? Now this guy at the age of 41 years started taking this medicine, and hair keep on miniaturizing. But even now he responded to finasteride in such a great way. He responded to finasteride even at this age. So why am I dying to give you finasteride at 1 mg per day in the beginning and immediately after transplant? Do you understand the desperate, how desperate the clinic or the surgeon is to give you finasteride? Please, please, please. Isn't it fishy? You are paying to people for the work which they are not doing, which the medicine is doing. So why can't you take if your surgeon says, and you believe the surgeon really that 1 mg dose is the best suited dose for you, and you believe him, so say, okay doctor, I have to take the medicine anyways, so let me start the medicine, let me see how it works on me, and after taking the medicine for maybe around 6 months, I'll come back to you, and then you do the transplant. Now in this patient, if you do transplant now after 1 mg finasteride, don't you think the equation, the number of grafts will change? Don't you think this? I think so. I mean, in the first case, I could easily bluff you, telling I'll do 7,000 grafts in this in your case, maybe 8,000, maybe 9,000. You must have seen all those things. But if I give you finasteride for 6 months, then I cannot bluff you, because you know what finasteride is doing and what the surgeon is going to do now. So the baseline for comparison would be this. From this you will compare the result now. Okay? So please, please, please don't have over expectations from your surgeon and from your donor and from yourself. Now the interesting thing is, many a times I get comments, so your hairline is still up. You have made a high hairline. The other clinic, why can't you make hairlines like the other clinic? they are getting the hairline low. You are making up hairlines. Why, sir? Why? You don't have enough craft. You are not as talented or as artistic as that XYZ clinic. Now see, my dear friends. Now see this. Now this case, he got his surgery done twice or thrice somewhere before coming to me. He got a low hairline. He got the transplant done. And in the same area, they kept filling it. But after first transplant, let me explain you his story. After first transplant, the patient was put on finasteride. So everything got filled. He got happy. After some, maybe around a year or so, he developed problems or whatever the reason was. I don't remember, but or maybe tolerance. The finasteride effect was fading out. He noticed so much of gaps. He got it filled again with some repeat transplant at some other clinic in the same area. Now he was thinking that the first transplant was good. He referred some patients, many patients rather, to the clinic. All the patients, friends and acquaintance, they actually, they were so happy to see the result after 1 year of surgery. And because the results were dramatic, and you now know why they were dramatic, because of finasteride. So they were happy, the patients, and the clinic got a lot of referrals. Oh, sir, you do amazing job and all that stuff. The patient gave happy testimonials for that clinic, sitting on sofas. Oh, doctor, you are amazing. Oh, doctor, come on. Now, what happened after the finasteride stopped working? He thought it is his fault. He got another transplant done and another transplant done 3 times. Look at his donor now. What happened to his donor? And now you can see the gaps behind the transplanted area. Now we need to fill this desperately. You cannot, take off your cap with this kind of hairline. You cannot shave off also. If you shave off, you are again in a trouble. I mean, you cannot do with this band, and gap. You need hair. So he went to the doctor again, but nothing could be done. So, and with finasteride, because he had already used it, and even now, if I start finasteride, it is not going to work that well. The doctor could have waited after one transplant to hold back the finasteride maybe for some time. It can be added later on. So this case which you are seeing here now, this is my hair transplant team member, and we operated him around 7.5 years back. And you can see the result after 7.5. I mean, in the beginning it was really good. We did not start finasteride. The patient was using minoxidil, that too, like twice a week or thrice a week, not more than that. Now he has thinning. Now after 7.5 years, I have started finasteride, and that too just 0.5 mg twice or sometimes thrice a week. That is very small dose. I'll share the updates as soon as we notice some changes. What happens now when finasteride can even work at this point of time? I'll make a separate video on this. You stay tuned. If you haven't already subscribed, subscribe. So now if you see this case, the patient is in big trouble. Now suppose if the doctor was really thinking about this, now how does the mindset of a transplant surgeon who is finasteride surgeon works? So I call finasteride surgeons and non-finasteride surgeons. Okay, I'm not non-finasteride surgeon, but yes, I would definitely weigh the pros and cons, the timing and the dosage. I don't give blanket treatment. So rather, the better word would be I would call this surgeon a blanket finasteride surgeon. Okay, who is giving finasteride to camouflage things, to upgrade his results, what he is not actually capable of. Okay, so now this blanket finasteride surgeon, how does he think? Okay, While making slits, he'll say, okay, I can bring the line low, I can make it look good. So everyone will say, doctor, you did a wonderful job. Doctor, you are amazing. Doctor, you are this. Doctor, you are that. Now, this area where he is thinning the transition zone, oh, come on, why shall I do this? There is finasteride, it will take care of everything. Why do I put grafts there? No need, no need, no need. So now this surgeon will leave these areas to the mercy of finasteride, and he'll show the results with finasteride. You will be very happy. You will say, come on, this ne to sara area cover kar diya. Amazing guy. All the transition zones will be taken care of without putting a single graft there. The hairline will become very soft and beautiful. So that is the reason why people have stopped doing transplants without finasteride. Many of them will say, don't get a transplant if you are not taking finasteride, because see, I am a doctor. I've done my transplant. I'm not taking finasteride. I'm not applying minoxidil. Okay, my transplant looks good. It is almost 1.25 years now. Okay, so now, but this is mehnat ki kamai. This is real hard work of the surgeon. This is the testimony of the skill and art of the surgeon. Okay, so but finasteride surgeon does not really need to have this. So blanket finasteride surgeon, be aware of blanket finasteride surgeon. That's my humble request to you. Okay, don't go to blanket finasteride surgeons. You are going to be in a big trouble, my dear friends, big trouble. So blanket finasteride surgeon can afford low hairlines, and what it does, sometimes it is so difficult to explain this to patients. They don't really understand this. They really don't understand this. I keep telling them, beta, आपका hairline नीचे नहीं ला सकते. We shall not get your hairline too low because you don't have enough donor resource. But he says, doctor, this clinic is doing this, that clinic is doing this. Doctor, come on. So what will happen? See, a good surgeon who is actually your friend, who cares for you, will listen to all this shit and will take all this shit on himself. Okay, just because he loves you. Okay, so if I am giving you less dosage, less medicine, that's for your sake only. Now, if you see this patient now, 0.5 mg, when the dose was reduced, how the effect came down. So, and if we reduce it to 1/4, the effect will further go down. And if he stops, entire thing will go. And in fact, the circumference of the hair which he had here in this portion will also increase. The baldness will also increase there, because these hair were happily living there, but now they become used to this medicine. So doctor can prescribe you finasteride 1 mg. That is good for the clinic for sales purpose, because but it gives fake hopes to the patients. Fake hopes. Many a times these patients, innocent people, they don't even realize. They think doctor did a wonderful work, but it is us who have some problems within us. They say, because once it is done, you are happy. You have given a testimonial sitting on a royal sofa. Everything is gone. Now the doctor has easily put the ball in your court. Now every problem lies within you. Doctor has done his job thoroughly, professionally. You understand this? That is something which you must pay attention to. Okay? So I am here. What I do generally, like, how should finasteride be used? It should be used keeping the interest of patient in mind, not the doctor. Okay, you have not taken this incarnation in this body to promote someone. Okay, to hang as a testimony on some clinic's wall. No, you are a human being with emotions, expectations, which we need to take care of. So, as a surgeon, it is my duty to mentor your journey, to see, I mean, to help you. Hair transplant is a journey; it is not a destination. So, even if some people think that, oh, I am going to this clinic, they give best, and even if everything looks best, it may not be that good in long term, you know. So we know people generally don't talk about tolerance. You know, minoxidil, the medicine is available at 2% and 5% strength, but it is also available in India at 7.5, 10%, 12.5, 15%. Why the hell they are increasing this strength of minoxidil? Have you ever thought? Because it does not work. All of you who know, who have used the medicines, including minoxidil and finasteride, please comment in the comment section. That's important because I want to know your views. And people also should, because see, I am alone who is talking about this, all alone. Okay, I don't think anyone else talks about this. So I need support from all of you because I'm talking on your behalf. So, see, the timing. I mean, you can introduce this medicine after maybe 6, 7 years also, 6, 7 months, 10 months also. There is no urgency. You can, if you are really caring for what you call the existing hair, you can give it at a small dose also. This patient, if you see here, we gave him 0.25 mg twice or alternate days. So that means 1 mg more or less in 8 days. Now, the non-transplanted area you can see have improved even now. So it saves your existing hair. So if the doctor is really concerned only about the existing hair, he will give you this medicine at a very small dose, not 1 mg. A good doctor will always be at your side, will always take decisions which are in your long-term interest. A person or a clinic who just thinks about himself will, bombard you with n numbers of PRP, all the medicines. Okay, apply minoxidil twice a day, 5 times every week. Take finasteride 1 mg per day. Whatever, you know this well. So come on. So I think this video must have helped you to understand a few basics about this, and I think you really deserve to know that's your duty, towards yourself. Okay, you can't be so, casual about your approach towards your hair transplant. If you are conveniently ignoring things, I mean, see, if you're watching this video, you must consider yourself lucky. And if you're watching it for the first time, you must consider yourself lucky. And in fact, let me tell this also. Many of my regular viewers, I read comments of each and everyone, every single person. Okay. Many of my regular viewers, they love me, they like me, they know that I am honest and I speak for them, but still they get bluffed. Still they get bluffed. They think some extraordinary capability some surgeon has, and see, it is finasteride. Come on, why don't you understand the magic of finasteride? I can also conveniently give a blanket finasteride treatment. See, when I can give you results without finasteride, this level results. Just imagine what can I do with the help of 1 mg finasteride. But I never give this. I've never given this. Okay, so I don't have a single case where I can show you 1 mg finasteride magic after transplant. So to summarize, it is very important to lay a right foundation of your journey. Okay, you have to find yourself a doctor who actually thinks for you, who plans for you. Okay, so planning is very important, really very important. And if you don't plan things, you are going to be in big trouble. Okay, so you basic prerequisite is, don't choose a blanket finasteride surgeon first of all. Second, choose a surgeon who knows all the techniques. If you are doing these two things wrong, you are inviting trouble, and you are going to repent for this for the rest of your life. Okay, and then obviously you can consult me, but I am a busy surgeon. Sometimes I don't get that much of time. You can, although I am available on some Zoom webinars, so I generally prefer doing group consultations. You can contact me through those webinars. Mm, that and you can join me on some live sessions also. So hope this video helped, and you should really get your basics right, and use your brain, use your common sense, and if you have doubts, please contact my team. We will help you. Thank you. Love yourself. Stay blessed.